IVM.
Welcome to All Things Policy, a daily podcast supported by Pragati, a flagship media initiative of the Takshashila Institution. We're a bunch of policy nerds based in Bengaluru, and we like to bring a fresh perspective to Indian affairs and an Indian perspective to global affairs. So grab a cup of coffee, sit back, and join us for today's chat.
Hello and welcome to yet another All Things Policy podcast. And today we have an interesting guest who will kind of dwell into aging and the various aspects of it. So she's had first-hand experience of working with senior citizens for over 9 years, and she has written enough to also tell us how this ecosystem operates. So, Nidhi, welcome to this All Things Policy podcast.
Thank you so much, Sowmya.
Okay, I also have my colleague Malathi, who heads the policy school at Takshashila, with me on this conversation. And I'm Sowmya, and I head the corporate affairs and HR at Takshashila. So let's take a deep plunge into this. We've already done a series on the layers of aging and looking at the preventive and the rehab care, but more so taking a deeper perspective on how things have progressed, right? Like just doing a quick recap on what most of us could relate to is how childcare and elderly care were so much part of a family ecosystem that people didn't have to worry too much about who's going to take care. And it was not an outsourced aspect of sorts. But now we are leaning into a completely different way of looking at it. And I think it's quite enterprising in a way, but it also has too many moving parts. So, Nidhi, let's kind of quickly have a recap on how the COVID actually looked at this whole thing, and did it pivot in a way that we started understanding elderly care more just because of the kind of pandemic situation we had? Because we spoke to a lot of women and friends who said it's so hard to work from home because sometimes elderly care services that were knocked off during COVID because of the circumstances, and that whole burden fell on the family. And in few cases, it was predominantly women taking that load. So, which meant remote working option, although it allowed flexibility, it also meant you're going to do a timeshare between elderly childcare as well as all of this, right? So just wanted to understand from your own experience how this looked like.
Yeah, sure. So I will just rewind a little prior to COVID, because I think as we started our journey with Silver Talkies in 2014, and being one of the first movers or players who entered the market in the whole senior care space, and since our focus has always been on how to promote active and healthy aging, right? I think the vulnerability of the older adults was even there back then. It's just that I think COVID probably highlighted it and brought it to the fore. But even when we started out, based on the observations that we were having at our own house, between myself and my co-founder Reshmi, when we thought retirement for our own parents would, be like a second innings where they would follow their, hobbies, or kind of start with things which they could not do while they were pursuing their careers or bringing up families, right? But none of those things happened. And when we went out looking for opportunities for our own parents, we found out that how there was no focus whatsoever on older adults, right? So I think as a society, we tend to take older adults for granted, given that they are adults, and we kind of assume that they can take care of themselves and everything is hunky-dory in their lives, right?
Yeah.
And as parents, then we start getting too engrossed with our own children, completely ignoring our own parents, right? I think COVID, for that matter, was that one trigger that kind of highlighted how our own parents can be a very vulnerable lot, and given that they are dependent on their house helps or on us many a times to take care of their needs. They were they were the exposed segment, right? And they were so highly exposed that I think they went through a series of emotions, like from loneliness to depression, and especially those who live in nuclear families now and away from their children. For them, I think the impact was the highest, because when we were researching even for our book, and since our book Rethink Aging was written during the time of COVID, a lot of people spoke about how they missed even hugging someone because there was nobody around, and how that led to so much of social exclusion, and so much of realization that how lonely they were in their lives, if their kids were living away, right? And then, yes, unavailability of attendance or unavailability of house help, yes, it did make even families who were living together made life a little difficult, because I think, yeah, as a society, women tend to be the primary caregivers and the primary household functionaries who take care of the entire household, right? So the burden of it did fall upon the women, and I think everybody cooped up inside that one small household, everybody on their toes. It was a difficult time for everyone to manage their work requirements, their home requirements, and especially if you are caregiving, then it was definitely a much higher burden for anybody to manage, and also then to limit exposure of the seniors to anything and anyone from outside, so that given that they were the most vulnerable lot during COVID, I think the dynamics were very, very scary at that point in time indeed. But I think the silver lining of that has been, given that it did bring out all these aspects of the older adults, how they are living, and it did bring about a sea change in the market dynamics, where suddenly everybody is, if you were to look at the market now, you will see a lot of startups who are now trying to solve the problem of the elderly and are coming up with new innovative solutions, whether they are tech enabled or health related or care related, right? So there is a sudden influx of new ideas and new service providers who are trying to solve for different problems that ail the elderly. But what will work, I think that is still remains to be seen, because we are still a very new market in terms of accepting senior care as a paid service. Because as you said, we have been so used to families taking care of family members. Senior care from outside and paying for it is something which it has become a matter of convenience, comfort, and of course disposable income, right? Because these services also do not come cheap, right? And so everybody cannot have access to it. So it's so there are a lot, as you said, there are a lot of moving parts which kind of define the whole senior care spectrum right now.
Yeah.
So actually, just wanted to add to what you had mentioned, Nidhi, is that even the National Commission on Population, right? Just a few data points to kind of reiterate what you've said, is that the share of the elderly in India is close to in 2011 it was close to 9%.
Correct.
So we're expecting it to almost double by 2036. Which means that there'll be 18% of the elderly by 2036, and whether it's from whether it's the policies that we have to outline, whether it's the market, whether it's is ready to kind of is prepared to take in that extra the population is also very important for us to think now, so that we're prepared for another decade or 2 decades down the line, right? And the main thing about the problems associated with aging is predominantly around 3 areas. One is the social that you had mentioned, where the society too is undergoing this rapid transformation, and so you have the children moving out of maybe the rural areas into cities, migration, and which leads to better opportunities, but which means that the elderly are left to fend for themselves. So the traditional values and institutions are sort of, in the process of erosion at this point, right? Then we have the second part, which is the financial, which you also touched upon. So retirement and dependency of elderly on their children for their basic necessities. and the sudden increase in out-of-pocket expenses, right? Especially with medical expenses, hitting the roof. This is a very important aspect which our parents did not even think of, because they would have thought, okay, it will be taken care of. But even for the children, it is difficult sometimes to manage, because they need to manage their household as well as the parents, right? And the third is, of course, about the health, which will be on the decline. There will be everything from issues with related to mobility to dementia, right, which is now becoming much more common, because we are aging, and we're going beyond the expected age that we earlier used to have, which is around the 40 years back in the 1920s to 70 years now, right, which is the expected. So with all of these problems, with all of these three areas, right, the social, the financial, and the health, I know Silver Talkies is doing quite a bit about this in terms of having these events and other things that you are organizing, right? Would you want to speak a bit about that and how that is helping in these three areas?
Yeah, sure. So, in fact, before I go there, I think what is important to understand in very plain, simple terms is, like, while we say, and like by 2050, 20% of India's population would be 60-year-old plus. Like 20 may sound like a very small number if you were to still think about it, I think. But the facts are that the elderly will actually outnumber the kids below the age of 15 by then. So imagine the old age dependency ratio will spike, where the elderly people are more dependent on the working population for their needs, and the number of kids in the country are going to decline, right? And which also means that 1 in 4 individual would be a senior citizen, would be a person who is 60 plus, right? So I think when you look at the stats like that, it really highlights that the time is now to really start actively looking for solutions which would hold us in good stead in the longer run, right? And I think you very rightly pointed out the problems that the concerns that seniors have, right? So there was a study. There have been many surveys which have been done with organizations like Age Well International or HelpAge India, and it's been very interesting that while health remains to be a common concern, but loneliness and social isolation are indeed one of the biggest concerns that seniors have, right? Because it's like sitting at home, having nobody to talk to, having nobody to engage with, nothing to look forward to, right? So it's almost like an epidemic which is out there waiting to blow over, right? And in fact, there is another survey called the Jug Jug Jiyenge survey, which was done in 2018, which had surveyed younger adults who had elderly parents living alone. And they were asked what did they think was the major concern, for their parents. And it was very interesting to see that almost, I think, if I remember the numbers correctly, almost 64% of those youngsters said that health was an issue, whereas only 10% of the elderly said that health was a concern. And on the opposite side, only 6% of the youngsters thought that social engagement was an issue for their parents, and 36% of parents said that actually it was social engagement which was a concern. So which also highlights the disparity that exists in our understanding of what our parents need, right? And unless we have that understanding, we really are not going to solve for that issue at all, right? So I think so with Silver Talkies, it's with that understanding that social isolation can be a huge dampener, which not only affects their mental well-being, it actually impacts their physical well-being as well. So yeah, so I was saying, so how, that lack of understanding or that gap in understanding of what our elderly really are looking for itself is a huge gap that exists, right? And what we have seen in our journey with Silver Talkies is that, since our focus has been, so we run something called a Silver Talkies Club, where the idea is to create this community for older adults, where they not only find like-minded individuals, and these, the focus is a lot on having new social networks and companionships and friendships to emerge out of it, right? And I think And since we also focus a lot on engagement, how to keep them as lifelong learners, and we also conduct a lot of fitness classes, a lot of programs which would help uplift their physical and emotional and mental well-being. So the what I have seen is that the peer-led mechanism actually does wonders to their emotional and physical well-being as well, because what they do in a group, right? Imagine if I were to take myself out for a walk every day, or if I were to expect myself to do a yoga class by myself every day, I may not stick to the plan because it's boring. I have to motivate myself. But when they start doing it in a group setting, and nowadays, since mobility can be an issue, transportation can be an issue to access classes, I think again the silver lining of the whole COVID thing was that online models became acceptable, right? Prior to COVID, seniors were very, very wary of technology. If you were to ask them to come on Zoom and attend classes, many of them would say no, right? Even though coming out and coming to a class may be a challenge for them, but then they were very, very close to the idea of technology. But I think COVID again forced them to adapt to technology. And now we have people who have been religiously doing yoga classes online with us, or doing fitness classes or Tai Chi classes. And people who have been consistent in the last 2 years, 1 year, 3 years, they themselves speak about how much their health has actually gone through a sea change. They are feeling much more fitter, much more younger, right? So I have these case examples of people writing to me on their 60th birthday, where a lady shared, she said, Nidhi, I haven't felt as fit at 45 as I am feeling today at 60. And I am feeling all ready to go out and have fun and have adventure now at this age, because I think at that age also comes the freedom, right? Because you don't have responsibilities to take care of. You can take care of yourself, you can do things which you want to do, right? But coming back to your point, I think more than social, of course, it is also finance also plays a huge factor into how much of it can you really utilize. What kind of financial resources do you have available to yourself? So I think that will always be a challenge, and even these surveys talk about how much how many of these seniors are still very dependent on their family systems for their financial support, because not everybody gets pension. Especially in the private sector, there is no pension unless they have savings. They also end up saving for the heydays when any health emergency may come up. So you really can't hope or expect, and it's very difficult to explain to them that invest in your social well-being, because that will keep you healthy in the long run. Because for them, health is only about physical health, and that comes directly from the idea of hospitalization. No, I need to save for that medical expense, right? And the Lassie study showed us that only about 18% of seniors have health insurance, right? Because as they grow older, the premiums go up so much that it becomes really unaffordable. And many policies have those minimum entry age and maximum time till they can avail health insurance. And also there are a lot of limitations that they are facing in terms of financial resources as well. But again, the good part is that I think in the last couple of years, because of COVID, since many startups started looking at senior care as one of the opportunity areas, there is some work which has even started happening in terms of creating second career or post-retirement work opportunities for seniors. The success has been limited because I think there is a lot more work to be done to open up the corporate sector also to these new ideas where they can actually use retirees in a meaningful and a productive way, right?
Yeah.
Whether it is in part-time contractual opportunities or in form of gigs, right? But I think that change is starting to show. Given the fact that the government also launched an initiative called the Sacred Portal, though it did shut down, but at least the intention was there that, to create this portal where senior citizens could list themselves to look for such second career opportunities, right? So I think we seem to be at the cusp of a time where the change and shift is starting to happen, but probably it will take a few more years for it to take any reasonable shape, which would impact a larger audience, so to say, right? And health, of course, healthcare expenses, we know treatments, how expensive they are. And as I said, health insurance being limited, that always is a takes away somebody's nest egg. So that one has to always be wary of.
Yeah.
But in my experience, as I said, I think active aging to me is the most promising form of preventive healthcare, because I have seen that change happening, improvement in health when they are active, when they are meeting people, when they are socializing, when they are keeping, attending fitness sessions and all. So automatically, I think they start seeing that shift. I have somebody telling me, oh, I didn't go through a knee replacement. Your fitness classes and yoga classes really helped me feel better. I did not have to go through the knee replacement surgery, which the doctors were advising me to do.
Stay tuned to All Things Policy. We'll be right back after a short commercial break.
Yeah. On that note, Nidhi, just to move on to a slightly different tangent now, if you look at the elders as one of the components, then you have the elderly care and there is elderly welfare. Elderly welfare more in the context of saying how retirement age in India is either 58 or 60 in most places. And sometimes people are actually productive, but they're forced to kind of make an exit. And even consulting jobs after that are very temporary in nature, like they'll give you a 6 months to 1 year contract, and it's on the edge all the time. So there's no insurance, like you said, there's no cover for health and things like that, right? So do you kind of have good examples where this life expectancy in the past was low, and that's why that 60 years was in action? But is there anything that the government is considering to rework on, or even look at, because I think the argument has been that as long as more elderly people are in the workforce, then it also ensures that youth do not get enough opportunities. There's this conversation always happening, right? Because they feel, there are more jobs that we need to create for youngsters also. But everybody is required in the ecosystem. So anything that you have to add on this?
I think it's a dilemma. It's a big dilemma, I think, that everybody is grappling with, where we still are in many ways a young country, where youngsters do need to be employed. We need to have opportunities for them, right? So, and on top of it, to say, okay, now you should create opportunities for older adults as well, or keep them longer term in the workforce. I think you would hear both sides of the ones who, the naysayers, and the ones who would support it, right? But having said that, I think the fact that lifespans are increasing and the health spans do need to kind of match those lifespans. And how would that happen? Only if people are still in active roles, right? Because I think it's very intuitive, even if you were not to look at studies or surveys, right? If one is out of job, what are they expected to do, right? And that's where it leads to decline in all sorts of health, right? It's their mental health, it's their emotional health, it's their physical health. Everything goes through a decline, right? And how do you prevent that then? Then the best way to do it is to actually keep them longer in the workforce, because 60 nowadays, if you ask a 60-year-old, are you old? They would tell you, what are you talking about? Right? Because they don't feel it at all. Right. Yes. I remember when we started Silver Talkies, right? And when we started approaching the 55 years old and 60-year-old, telling them that, Silver Talkies, this is what we intend to do. It's for older adults. It's for, and we used to use the word seniors back then. And it was very surprising, and we were used to find it very weird and even amused. We were used to be amused at times when they would say, yeah, I have like 80-year-old elderly, in my network or, in our community, we will connect you to them. And we used to wonder, but what about you? Right? Yeah. And then came the realization that actually it is so natural, right? At 60, they are not feeling old at all. right? I am 47 today, and I probably feel much better than what I used to feel in my 30s, because probably I'm investing more in myself. I'm taking care of myself much better. I have the wisdom and the maturity to, really take care of myself, which I was completely ignorant, or I was ignoring when I was in that age, because I wanted a certain other kind of lifestyle, right? So I think by the time they reach their 60s, they are at that awareness level where they are feeling very exuberant and lively and want to do new things, right? So in fact, about the retirement age, I think recently there have been few very encouraging news where there was a news about how the parliamentary committee actually recommended that the tenure of the judges would probably increase beyond 62 and they could retire at 65, right? Similarly, there was another news about for PSU bank chiefs, where the government is considering raising the retirement age by another 2 years, right? So I think, again, there also that awareness is now coming that 60 is not the age to retire anyone. They can last, they can continue longer. And I think coupled with those ideas of how like there are so many new roles which are coming up, like content writing roles, you can do consulting roles. There are so many startups which need specialized help, and then there are experts who have worked for decades and decades in an industry who can be such good resources to give them that help, right? So that matchmaking which can happen with the wisdom and the experience and the requirement of the startups and all. So there are a lot of new possibilities emerging there now.
And also, it's interesting if we bring in even the government angle to this, right? Knowing that like the demographic dividend window, as we call it, right, between that is the working age population is highest actually in India now. From started back in 2021, and it'll go on till 2041. We are the most populous nation, of course. We got that title this year, but we know that this will also peak in the 2030s. So, like when you mentioned that in the seniors should be employable, because the tacit knowledge that they have, the wisdom that they bring to the table with respect to many areas, right, is should be utilized, right? We should not think of them as retired at a certain age when somebody does have the capability. So the other interesting point here is that India is not kind of utilizing this dividend, as in the demographic dividend window that we have of the population, the working age population. In fact, the rise of US, Japan, and China after the World War was fueled by the combination of some of these factors, and they kind of, if you notice, there was a sudden peak in how they've done, even the GDP wise. But for India, we are not there. In fact, it's almost like we're not. We have not taken advantage of it, or we've not anticipated it early enough to be at an advantageous position now. So I think from the government to policies that we could bring in, whether it is from from the increasing the retirement age, for example, or if there's any other policies that you might think, like for example, the caregiver or the agencies that we have now, the dime a dozen out there, but it's all in the informal sector. And most of the time, children who are living outside the country are dependent on these agencies because they provide the 24/7 care. They can provide that for a pretty high fee, but they can kind of cater to that. But then the demand and supply here is quite skewed, right? So any other areas you feel that the government could potentially step in, keeping in mind how other countries possibly have fared?
See, I think the main challenge that our country is seeing when you're talking about, say, care, for example, right? The home health care and stuff, right? I think the main challenge has been around skilling, finding skilled resources who are equipped and trained to take good care of people that they are taking care of, right? There you would find a lot of people who have utilized these services complaining about how difficult it was to find the right care attendant, right? They have to go through a series of changes and all till they really find somebody who's working for them, right? So I think from a policy level, from a government level, I think there do need to be and I'm not sure if it is only the responsibility of the government. I do know that in the private sector also there are many companies now who are getting into the training of geriatric nursing, and they are getting into the space or this whole new field of geriatric counselors, right? So that field is picking up. Like from a time I remember when we started, geriatric doctors were hardly in India, right? And Bangalore was one of the few cities which had a geriatric doctor, right? And but now I think the number of geriatric doctors and even people who are specializing in geriatric space, that number is improving. I think because now everybody is having the realization that how this is a segment which, one, from an opportunity point of view, and two, from a need point of view, will need to be catered to, right? So I think that change is anyways happening, right? So that is something which is there. So one is from skilling point of view. Two, for example, the other thing which very recently there was a news about Niti Aayog really talking about how there needs to be a public-private partnership around old age homes also, right? Because that's the current old age homes, as we understand them. Forget about the senior living, new concept of the senior living, retirement living communities which are coming up, which is more like those who have again the money to buy those, or who have the resources. And then but the old age homes as they were known earlier, the state of them, the condition of them is not really up to the mark for anybody to really go and stay there. Very few of them probably have good conditions, living conditions. So I think Niti Aayog is now talking about how to really mobilize a public-private partnership to create this whole, ecosystem of old age homes, which will serve the emerging population, right? So I think, to my mind, at many levels, it has to be a public-private partnership, specifically also because the population scale that we have and the kind of diversity that we have in our country, right? There is never going to be a one-size-fit-all kind of an approach that would work, right? If you go state by state, even the pension that the state governments have approved, the levels are so different. And currently even minuscule, like somebody offers 500 a month, somebody offers 2,500 a month, but in today's inflation background that we have, do you really see somebody living with that kind of a money? Not possible, right?
Yeah.
So I think there is still a lot of headway that we need to make at different levels to really make it a country, an economy which is senior citizen friendly. And as I said, the only hope is that, given both the public sector and the private sector is starting to recognize, and there are initiatives which have already been, taking place, have been shaping up. I think that's a good start. I think one can be optimistic about the space going forward, even with the private players. Earlier, I think getting funding in the senior care space was difficult, but recently there have been a lot of instances where home healthcare companies have been able to get funding, right? So I think even with investors coming into the market, it will make it more possible for these ventures to scale up and then reach out to more and more people, and that will allow them also to innovate and get better at their services and everything else. So I think it's just a few years before we really see a stabilizing of a senior care industry as such in our own country.
Yeah. On that note, I think maybe a solutioning in the context of how we have a PF component, right? Most working professionals have a part component, which is a should and must when you're working in a organization where it's set aside, and it's something that people don't see a burden to set aside, also because it's directly a deduction from the salary. So maybe one way of looking at it would be to keep a small fund for care, because now we don't have the pension component. Maybe something will keep us all moving in a way. Just thinking through a few ideas that might be useful in looking at how the policy angles will look like. I mean, if we had to implement, given that also caregiving in future is going to look a lot more that it's something you should start thinking well ahead proactively and start thinking about the steps, and not like the digital bill. I remember we had this conversation, right, Nidhi? It's a thing that people shied away from, but today we have platforms and tech intervention happening where youngsters are already looking at sorting out anything to do with their assets and having liquid money for health expenses and having insurance in place, all of that. I think the market, like you said, is evolving, and the society, of course, like you mentioned, should be more participatory in nature. And with that, I think with the Samaj Sarkar Bazaar framework, we'll be able to bring more solutioning into the space. On that note, thanks so much, Nidhi, for being there on this conversation. I think it opens up a lot of avenues for all of us to age gracefully and think about it in a way that we are more well prepared. And thanks, Malathi, for being on this conversation.
Yeah, thank you so much. In fact, I would say I think we have a lot to be hopeful for, because even if you were to look at some of the policies which the government is bringing out, like the Pradhan Mantri Vaya Vandana Yojana or the Ayush policy and stuff, right? So it's as I said, like our country itself is so big. So one has to find really innovative solutions which would reach out to a larger audience, because in spite of the policies, many people feel it is not reaching them, or it is meant only for the poorly poor elders, while many middle income class people may also be suffering. Yes. So I think, so together there is a lot that can be done. And I think we should end on that optimistic and positive note that we have started a great trend in solving for the problems of the seniors, and hopefully very soon we would be also among those countries who are considered to be senior friendly places, and in the likes of Norway, Sweden and other countries that everybody talks about, and the blue zones that everybody talks about these days.
Thank you, Nidhi, and good luck to you, to the Silver Talkies team as well.
Thank you so much. Thank you both.
Yeah, stay online, Nidhi. On this note, listen to our other episodes of All Things Policy, which is available on the IVM Podcast Network.
If you liked our show, don't forget to check out other interesting podcasts on the IVM network. You can tune into them on the IVM Podcast app, ivmpodcast.com, or wherever you listen to your podcasts. You can also follow IVM on social media. The handle is @IVM Podcasts on Twitter, Facebook and Instagram. And hey, if you'd like to dive into Takshashila's research on technology, strategy and economic affairs, check us out at our Twitter handle @TakshashilaINST or our website takshashila.org.in.